Why don't we start with you just telling your fans a little bit about yourself?
Fans. Originally, I grew up in New Jersey. Youngest of three. I have two older sisters. The oldest one's a surgeon, the other one's a nurse, and has a finance degree, so I'm the slacker of the family. Got my doctorate of physical therapy at Northeastern University, graduated in 2007. After that, moved down to North Carolina, where I worked at Wake Forest Baptist Medical Center in the acute care setting, mostly on the joint replacement floor.
Your family's from?
Originally from Vietnam. They were refugees. Don't have much of the story, but I know they were picked up on a 36-foot boat with the rest of their family members after 2 weeks by the U.S. Coast Guard. And my dad knew I think he said Statue of Liberty, and so they dropped him off at Jersey City, New Jersey.
and hence you're a Jersey boy now.
Hence I'm a Jersey boy, yes. Hence I'm
Excellent.
a Jersey boy.
So that's a powerful story. I mean, you must have shaped the way your parents kind of raised you and your sisters.
Yeah, my older sister was very young. She was born in Vietnam, but she doesn't remember any of it. My the middle sister, she and I are both natural-born Americans. But I guess, yeah, I mean, hard work and school always came first for us. Yeah.
Cool. Why did you pursue a career in PT?
First true experience with physical therapy was during my first co-op as an employee in New Jersey at the Kessler Institute for Rehab in West Orange, and it was outpatient, but I did outpatient primarily with patients with spinal cord injuries, so that was a big eye-opener for me, and I thought I was going to do that the rest of my life. Working with that population actually showed me how rewarding it was to work with a patient and get them towards their goals and get them a patient back towards their life and livelihood without needing as much assistance or being in pain or having limitations.
Are there particular areas or aspects of physical therapy that most interest you or capture your intellectual curiosity?
I feel very comfortable with shoulders, knees, ankles, hips, a lot of total joint patients, especially with my experience in acute care. I've had several patients come to me and thank me because they came to prehab and they were able to really impress their therapist by showing while in the hospital after their joint replacement, because they knew what to expect already. So that's something I'm very proud of.
Alan, you have a growing practice of patients with neuromuscular disorders, and we have a growing number of neurological practices or neurology practices who are referring patients to us. And it's most likely due to your specialization as a certified LSVT big practitioner. And so why don't you tell us a little bit about how LSVT big can transform the life of a patient who's dealing with Parkinson's disease, and then for you, how's it gone?
Program how's it transformed a patient's life? The program takes 4 weeks, and in that 4 weeks' time, I see patients become who they once were physically. I see a lot of family members come and tell me that this was the man I married or this was the woman I married, because it helps with their mood, it makes them much happier. 2, it gives them a good exercise program to do every day, and exercise makes people happy, so that's a good thing. It makes me, as a therapist, very gratified to know that I've been able to help the patient get back to certain things that they're able to do, that they haven't been able to do on their own for a long time.
What do you most love about being a PT?
I like helping people, and I love the stories I learn from my population. You can treat a lot of knees, you can treat a lot of shoulders, but every person has a different story.
How would you describe your approach to patient care?
I would say it's flexible and collaborative. I take a lot of time to educate my patients so they are aware of what needs to be done in order to achieve their goals, in order to progress through their physical therapy plan of care.
What kind of guidance or coaching would you offer to somebody who's in or approaching their second 50 years and is dealing with any age-related challenge, whether it's joint pain, back pain, loss of some mobility, whatever the challenge might be, what would you offer to these folks as sort of wisdom?
My piece of advice for people over in their second 50 years of life, to overcome whatever they are dealing with, or what I would say, don't accept no for an answer. You deserve more. And don't be afraid to try something new.
What do you do in your off hours for fun? What are your interests and hobbies?
It's kind of, well, I've taken an interest in martial arts. I've been doing it since 2007. Mostly Muay Thai, kickboxing, and Brazilian Jiu-Jitsu. I'm a blue belt in Brazilian Jiu-Jitsu, and I'm assistant trainer currently at Integrated Martial Arts around the corner where we work, which is awesome. Played sports all my life, 8 years of baseball, 12 years of football. No, I love fishing. And that's a new hobby of mine. When I lived down south, it was something to do, and me and my buddies, we did it. I didn't catch anything for 2 years, but now I go out as often as I can.